All right, so thank you very much, everybody, for joining us today. This is going to be a rehash of a webinar we gave a couple weeks ago when we were actually in the same place. But for today, we are going to be talking about medical school versus veterinary school and what to know before you apply. So today you have your panel. I am Dr. Jessie Sanders. I am a DVM, which is veterinarian, for those of you who are unfamiliar with it. The certified aquatic veterinarian is what I do as a fish veterinarian. And my panelist is Dr. Bailey Sanders. She is my sister, and she is a people doctor, and we'll be coming at this from the medical side.
Hello.
So a little bit about our background. I have a bachelor's in marine biology from the University of Rhode Island. I graduated in 2008, magna cum laude, and did my senior honors thesis with them as well. I graduated with my DVM from Tufts University in Massachusetts in 2012. Like I said, I'm a certified aquatic veterinarian. There is no board certification at this time for aquatic veterinary medicine. I am one of the very rare private all-aquatic veterinary practitioners.
And I did my undergrad in exercise science. I also played Division I college softball. I got my medical degree at Penn State, and now I'm currently in my 4th year of general surgery residency.
And what letters do you get after your name when you're done with that?
MD.
All right, you don't get anything for your boards?
No.
Oh, learn something new. We always get letters after ours. All right, so this has actually been reformatted. There are 15 questions. Any questions, please send to the email below, drjessiesanders@gmail.com. That is my email address. Any questions specifically for Bailey, I will forward to her. So, question number 1, what did you want to be when you were growing up? So for me, I was one of those kids who knew that I always wanted to be a veterinarian, even from a very young age. We had cats and dogs growing up, and I pestered my parents to no end for a little kitten of my own, and that basically got me started in veterinary medicine. From there, I kind of diverged a little bit and ended up going into a very small specialty within veterinary medicine, but it's great, and I am very thrilled that I am doing exactly what I wanted to in my career.
I didn't know what I wanted to do growing up. I thought I wanted to be a bartender. I wanted to be a professional athlete. When I went to high school, I thought I wanted to be a physical therapist, and I shadowed in physical therapy for a while, and I thought it was not what I wanted to go into. I thought it was a little bit boring. So when I was in college playing softball, we dealt with a lot of sports injuries and worked closely with the trainers, and I know the lifestyle of being an athletic trainer is also poor. So the idea came up to go to medical school and be a doctor. So I thought, I'll do that.
And how did you end up in surgery?
People say that you shouldn't do surgery if there's any other, area of medicine that you could possibly be happy in. But I knew I wanted to do surgery from the minute I went to medical school. I'm very hands-on. I'm a former athlete. I like doing mindless drills, and surgery fits the bill.
All right.
I can take a lot of abuse, yeah.
Question number 2, what was your greatest inspiration to becoming a doctor?
I think for me, being an athlete, everyone who's, from weekend warriors to high-level athletes gets athletic injuries, and seeing my friends and myself go through athletic injuries and need surgery, need medical therapy, you get exposed to doctors a lot, and I thought that was really cool, and that was something that I could do. So that was my inspiration.
For me, I learned a lot from our local veterinarian growing up when we were taking all of our pets to our little small animal practice vet. My inspiration for my career actually came from a program that I went to after my 2nd year of veterinary school called Aquavet. Basically, it's a 4-week program with Cornell and UPenn that bring together aquatic veterinary professionals from all different aspects of aquatic medicine, people who are working in lab animal, private practice, mammals, and it was a great program. I learned a lot in addition to making a lot of great contacts, a lot of people who I still talk to on a regular basis today. All right, question number 3. What are the requirements for admission? So for veterinary schools, there's only about 30 to 40 schools within the U.S. right now. There is talk of a few more coming online the next couple years. For all those schools that are members with the boards, they have a spreadsheet of all the requirements for all the different programs. It's included in the link on the spreadsheet here. Recommend that if you are considering veterinary school, look at that very early. There's some programs have very random classes that you need to consider taking. I was actually excluded from about 3 programs just from the fact that I hadn't taken a nutrition class. So definitely check that out early and make sure that you can fit the necessary classes into your schedule.
Medical requirements are very similar. You can see the website below. A lot of biochemistry, chemistry, physics, anatomy and physiology. And then they do want to see liberal arts classes, that you're well-rounded. But there's a pretty typical pre-med application program at any undergrad institution. That being said, you don't have to be a biology or chemistry major in order to go to medical school. They are very encouraging these days of alternative degrees like music or humanities and that sort of thing. As long as you do the medicine prerequisites, a little bit of diversity in your undergraduate degree is a good thing these days.
Yep, and the same applies to veterinary school. Thank you for pointing that out. All right, question number 4. How many schools did you apply to?
Medical schools, I think I applied to 12 or 15 medical schools. I was in softball season, so I had gotten 3 interviews. I went on my first interview and I liked it so much that I accepted there when they offered me a position. So I did, I think, less than the normal medical school applicant because I was in season. Residency is a different beast. I applied to, I think, 30 or 40 schools and I went on 23 interviews. But as far as medical school goes, I think 12 or 15, and I went on 3 interviews.
And got your first choice at both of them.
Yay!
Yay! All right. For veterinary schools, I applied to 6 schools. Got waitlisted at one. Didn't get into the others and ended up making it into Tufts as a waitlist student. So in the end, it probably worked out just because I was the one weird fish kid that they probably don't have that many of. So another example of where diversity can work in your favor. I did not go on to an internship or residency, so I didn't apply to any programs. For veterinary schools, just like medical schools, there is a match that you enter for internships and residencies. So you will basically try to work it out where you want to go and interview at those programs or do externships. And then they'll take every single student in the country and all the different programs and put you in some sort of algorithm, and in the end it'll spit out who's going where. So works very similar in medical school as well for internships and residencies.
Mm-hmm. That's for residency. And I think I'll point out that even if you struggle to get into medical school or veterinary school, that doesn't necessarily mean that you're not going to be a very successful veterinarian, a very successful doctor. They have their qualifications on paper are very different from how successful you'll be in life. So like look at the other Dr. Sanders, got waitlisted, got in, and has gone on to be extremely successful. So what they see on paper and whether or not you're a good candidate on paper to get into school, you struggle to get into school, it takes you multiple applications to get in, sometimes is not a good reflection of how you'll be as a doctor.
Yes, and another thing with veterinary schools, since there are so few of them, a lot of people do not get accepted their first time. I was certainly not expecting to, especially when I got waitlisted, but turned out all right in the end.
Jessie likes to remind me how many fewer veterinary schools there are than medical schools, and how it's harder to become a veterinarian than a doctor.
Yeah.
There are lots of medical schools.
All right. Question number 5. How many years of classes versus rotations? So for veterinary school, we had about 2 and maybe 2/3 of a year as didactic classroom learning. Certainly you have your labs and you do clinical skills, which is basically going to play with farm animals one afternoon every other week. Lots of fun with animals that I'll probably never see again. And then the last third of your third year and then all of your fourth year are rotations that can be either on campus or off campus. For veterinary school, you have a long list of programs you're required to do. Tufts did not have any tracking programs, so we were required to do both small and large animal rotations. Some veterinary schools offer tracking, where basically you can choose to be small animal, large animal, lab animal. I think shelter medicine is another one. So you'll take rotations based on your track. You also get elective time where you can go off and either repeat rotations on campus if there's a specific specialty that you're very interested in. Again, if you're going for an internship or a residency somewhere, you might spend a couple weeks there. I was the weird fish kid, so I went off and did programs at SeaWorld, Marine Mammal Center, Mystic Aquarium, and at a private aquatic veterinary practice out of Buffalo, New York.
In classic medical school, it's 2 years of didactic classes and 2 years of clinical rotations. That 2 years of classes is anatomy, biochemistry, physiology, etc. And then the rotations, you rotate through the buffet of medical specialties as a medical student. You get your feet wet in medicine, surgery, OBGYN, family medicine, pediatrics, etc. A lot of schools have tried to shorten the years of didactics, so you do 1 year or 1.5 years of didactics, and then the majority of your rotations in specialties as clinical rotations, and that's always changing and evolving. When I went to medical school, it was 2 years of classes and 2 years of clinical rotations, but some places are changing to shorten the years of classes.
Do you think that's a good thing? Would that help, you think?
To be seen.
Okay, fair enough.
All what you make of it.
Yep. All right. Question number 6. What was your most challenging class and rotation?
My most challenging class was probably the most challenging science was the biochemistry, I think. My medical school also was very progressive in the fact that they did a lot of humanities teaching. Which I think is a great benefit. You know, it teaches you how to talk to patients and how to understand illness. And I think in the end, that was a very powerful addition to the curriculum. But that was very hard. I'm not good at feelings and poetry, and I think that was very difficult for me. But at the end, I think it was a great benefit, and one of those things that you suffer through, and then in the end, you think, well, I'm really glad I did that. And I think that was a big benefit of my medical school. My most challenging rotation, I think the easiest one are the ones that come easy, surgery and gynecology, all the surgical related things. But any rotation where you had to talk a lot and think a lot, sit a lot, like psychiatry and family medicine, that was most challenging. I like the surgery ones. I don't like the ones where the psychiatry was my most challenging rotation.
For veterinary school, the class I think I struggled the most with was microbiology. So again, in animals, there's lots of little bugs and parasites, and you don't just learn them for dogs. You learn them for dogs and cats and horses and cows and pigs and sheep and goats. I think maybe there were 2 aquatic ones that, looking back, weren't really that significant. It was just a lot of information. I didn't process it well. My brain wasn't able to kind of focus on what was most significant. So I actually ended up having to take that class again in the summer. I obviously passed it then, but it was just one of those classes that it was a lot of information, and I didn't just, couldn't get all in my brain. As far as rotation goes, my hardest rotation was anesthesia. To this day, I do anesthesia on my patients on a regular basis, and I find it very simple and straightforward. But while I was working in the hospital, I couldn't get anything to stick. I worked extra with all of the faculty, tried to do extra problems and figure out where my brain was having the issues. And unfortunately, nothing ever clicked. But made it through, and now I do it in a much different capacity, which I am much more comfortable with, and have actually gone on to teach other veterinarians how to do anesthesia on fish, which is awesome, because it's great, because you can't restrain a fish patient. All right, question number 7. What was your favorite class and rotation? All right, my favorite class, I really liked, like my sister, surgery. So as part of veterinary school, you're required to have a spay lab. So basically, rescue dogs come in, and you as a student are responsible for spaying them. So you get the whole video. They have lots of basically practice ties that you do with rope. You get a fake skin block to practice on. But the actual surgery itself was a lot more straightforward and actually fun for me. So I had a great time doing spay lab. And as far as rotation goes, well, I'd love to say that all my fish ones were the best, but as far as the ones that I did at Tufts, I really, really liked my wildlife rotation. Tufts has a great wildlife program with some of the top-notch wildlife vets in the country, and they were the most supportive of my desire to be an aquatic veterinarian and do something that was at no means traditional, and it still isn't. But they let me do a lot of work with all the aquatic patients. So unfortunately at wildlife, that means lots of snapping turtles and ducks and geese who all wanted to maim me in somehow. But that was my favorite rotation, was with the wildlife clinic. Yeah, you don't have to worry about your patients maiming you, do you?
My children. My favorite class was anatomy. I think that's true for a lot of medical students. We had a class at Cadaver Anatomy Lab, so there were, 100 medical students in 2 classes and, 30 or 40 cadavers, blessed people who had donated their body to science. And you did real dissection to find real anatomy on real people, and that's just a fantastic experience. And a lot of, it's difficult to find cadavers these days. Not a lot of people want to donate their body to science. I think classically, in the 1900s, 1800s, they didn't donate their body to science. So cadaver anatomy is going away, which is really a blow to medical school and surgery. But in some places, they still do cadaver anatomy, and that was just the greatest experience. I think that was true for everyone else. Very difficult, but very rewarding. Now that's the way to learn medicine. My favorite rotation was obviously surgery. But I liked a lot of the rotations that were very hands-on and felt to me like I was making a very direct, very big difference in patients' lives. And I think the specialties that I liked were the ones where you saw instant gratification, which says a little bit about my personality. But surgery, in 6 hours, you can make somebody better. As internal medicine, it takes 6 months. I wasn't ready to wait for that. I liked OBGYN, I like the delivering of the babies is fun. I liked radiology a lot because you got to show up at 9 and leave at 5 and sit in that dark, quiet room all day. It was really nice.
That was ours too.
Spend their mandatory lunch hour outside in the sun in order to get their vitamin D. So I like those rotations. Seeing the radiology, that's a big influence in the kind of surgery that you do. So yeah, those are my favorite rotations that were hands-on, instant gratification, and surgery-based.
Yeah. Oh yeah, I remember radiology. It's fun. Everybody else is running around, and you're just like, I'm gonna sit in a dark room for 4 hours and look at this picture.
Yeah, it's great. The actual reading of the radiology films is really stressful, because you can't miss anything.
Yeah, but now
you really got to know your stuff. You really got to know your stuff as a radiologist, and as surgeons, as a surgeon in training, we really depend on radiologists, and a good radiologist means that you're a good surgeon, I think.
Yeah, we do a lot of radiology, and our new ultrasound is going to be here soon, so I got to get good at that. So that's going to be awesome.
Yay!
I can't wait.
Yay!
All right. Question number 8. How did you deal with the stress of school? What was your support system?
Well, I had the benefit of having a doctor in my family who had already been through it, so I called her a lot to talk about, the stress of school, and classes are hard and I hate it, and she would remind me that, you know, there's the light at the end of the tunnel, and it gets better. And so that was beneficial to have someone in the family who'd already been through it recently, who could tell me, you know, it does get better at the end. In medical school, I think it's a very healthy community of people who do medicine. So there's a lot of runners and triathletes and bikers, and so we'd have running groups and stuff and get together and exercise, and that was a good you know, group way to exercise some stress, but also to whine and moan with each other. So that was fun. I did a lot of triathlons in medical school. I think that was good stress relief as well. It's helpful to do something in where you feel like you're successful, because sometimes medical school doesn't feel that way. So yeah, calling my sister, exercising, hanging out with friends. That was a good support system.
Yep, and we still do it to this day.
Yes, we still bitch.
Yep, and I send her lots of boxes of snacks when she needs them.
Oh yeah, I like snacks.
All right. For the veterinary side of things, I unfortunately did not have an older sister. But I had good group of friends. Like I mean, you're all in the same boat. A bunch of you are coming straight from college, and this is probably a lot more difficult than your college career. Mine was considerably more difficult. Had really good support with friends, but I don't study well in groups. So really just taking time for myself and knowing that I could kind of just take myself away and lock myself in a cave for a couple days to study. That's just what I needed to do. About halfway through the program, I met a great guy who was very supportive. And in addition to him, I got his whole extended family as well for support. So it's really nice to have people who are local that I can just go, and Mom will cook me a homemade meal once a week and just hang out and be family time. So thankfully, I still get to do that to this day. So that was my main support system, because we are hermits like somebody else in our family. All right, so question number 9, difference after graduating, internship and residencies. For veterinary school, the day you graduate, you can start practicing medicine as a private practitioner. You do not have to go into internship, which is usually only about a year long. And after that, residencies can vary from 2 years to, I think it's 4 or 5 years for surgery. But again, you can just do an internship and get a little bit better footing with either emergency medicine, radiology. If you want to be board certified in something, you will need a residency. Tufts, when I was getting ready to graduate, was very serious about its students doing an internship, and I just knew it was not going to be for me. So I ended up not doing either of those and opened my own private practice. I did look around for a regular private practice job for about 6 months after graduating and didn't really find anything in the area I was looking at, so I went ahead and opened my own specialty practice. There are aquatic animal internships available. However, they require an additional internship year in either a small or large animal rotating practice. And then as far as residencies goes, there's only 3 in the country for aquatic medicine. And after that, you sit for your zoo boards, not any aquatic boards. So for those of you who really, really want to work with marine mammals, you're going to have to get into one of those residencies. And I'm going to warn you, it's extremely competitive. Everybody wants to be a dolphin veterinarian. So what are you going to do?
I do.
So yes, they're cute and cuddly, but I love my job working on fish. They are working on developing a board specialty for aquatics. They just need to see that the demand is there. So if you are interested, definitely get involved with different aquatic programs and make it known that you want that specialty.
We went to SeaWorld once, and I wanted to be a dolphin trainer.
Yeah, right. That was last week.
Already in residency. On the medical side, internship and residency is just part of the process. It is definitely required. You cannot practice anywhere unless you've completed an internship, even in the military. And again, like Jessie said, in order to be board certified, you have to complete a residency. Being an intern means you're in your first year of residency. So an intern and a resident are actually the same thing, but the intern is in the first year of your residency. There are residencies for every specialty, and they are all different. The shortest being 3 years for family medicine, internal medicine. The longest being 7 years for neurosurgery. Most surgery programs are 5 years. A lot of academic programs are adding 2 mandatory years for research in the middle. So a lot of academic surgery programs are also requiring 7 years. I'm in a 5-year program. Residency, like Jessie said earlier, you apply an interview very similar to medical school. And then you go into the match, which is a giant computer program. You rank the schools that you interviewed at, your favorites 1 through 10. And then the schools who interviewed you rank their favorite candidates, 1 through 10. And then this giant computer program puts everybody's names together, and Siri decides that you'll be going to this place. And you all open your letters on the same day in March throughout the country, and hope you like what you get. It's a very equitable process. I think it's very medieval, but it's fun, and you tend to get your top, one of your top choices, unless you're trying to couples match with your wife who wants to go into a super exclusive specialty, and then you get what you get. Internship is the first year of residency. Being an intern is difficult, and that comes with the territory. But if you can survive intern year and become a real resident, the rest of residency is a very fun and life-shaping experience, which is where I am now.
So most people do their internships and residencies together at the same location?
Not necessarily. A lot of subspecialties like ophthalmology, like radiology, sometimes you'll be matched to a different internship. So one of my friends did her internship in Pennsylvania and then did her ophthalmology residency in Oklahoma. And that's what the match chose for her. And that doesn't happen very often. If you can get your internship and residency in the same place, that's great. And that's typically how it works for surgery and medicine. But that's not necessarily the case.
Yeah, because that's very rare for veterinary medicine. They want you to do something weird and different. So they'll usually, if you want, like, say you're interested in coming back to your school as a resident, they will kick you out and tell you to go somewhere else for an internship. And they'll probably take you as a resident, provided you survive the internship year. But it's very rare to be in the same place for both the internship and the residency.
For surgery, at least, it's a 5-year program, so you tend to do your internship as the first of 5 years at one institution. But a lot of people like, the opportunity to go do 1 year somewhere random, do 1 year of internship in New York City or something. Some people like that opportunity, but I'll agree, like 75% or more, you do your internship at the institution that you'll be doing your residency.
Alrighty. Yeah. Next up, question 10. How do you get into different specialties? Which I think we covered a little bit already.
If you are an undergraduate, don't worry about it. You have a lot of time. If you are in medical school and you're in your clinical rotations, you'll get to sample all of the specialties. So you'll do a month of surgery, a month of medicine, They have some elective time for subspecialties that aren't necessarily included, like ENT and ophthalmology and anesthesia. So you'll do one of those rotations in your clinical years of medical school. And then you'll apply for subspecialty areas, and matching into subspecialty areas like orthopedics and ENT, plastic surgery, can be much more difficult than matching into generic, general surgery, general internal medicine. So while you are in medical school, you have to get good grades, test well, and show your interest by being involved in interest groups, associated with your specialty. There's lots of medical student interest groups that arrange for visiting speakers and have wet labs and stuff like that for people who are interested. So as long as you, get good grades and demonstrate your interest, you'll have a leg up into getting into those specialties. But it's not uncommon for people to apply for specialties like orthopedics and ENT and not get in and get matched to a 1-year general surgery internship, because most of those subspecialties make you spend a year in general surgery as an intern anyway, and then you'll reapply to the match next year.
Okay, gotcha. For veterinary medicine, like I said, they're going to make you do a little bit of everything, be it small or large, unless you have a tracking program. Definitely, if there's something that you're interested in, join a club, join an association. So for fish vets, there's two big ones that offer student memberships. So if you're a veterinary student interested in aquatics, definitely join up. Usually it's $50 a year at most, and a lot of their conference registrations will be discounted for students. So join up with those specialties that you're interested in. I mean, even if you're not interested right from the bat, a one-year membership isn't going to really hurt you that much. And definitely make it known to those faculty that you are interested in that specialty. Like squeaky wheel gets the grease. If you're very interested in ophthalmology or something like that, talk to them about your interest, and they will, I mean, a lot of people are like, great, another one for us. Yay, let's help them out, tell them, and they'll basically give you lots of good mentoring about how you should approach the specialty, where to go for different programs, who to talk to for more information. And a lot of good information can just come from talking to faculty about their specialties. They love to talk to students. It's their job.
I'll say it is the majority of people going into medical school who think, oh, I want to be a ENT or I want to be a surgeon. Everyone changes their mind. I'd say like 20% of people end up doing the specialty that they thought they would do when they got into medical school. And that's just because you don't have exposure to specialties before you start medical school. So everyone wants to be a neurosurgeon. Everyone wants to be a pediatric surgeon, you know, but by the time you get into medical school, you find something else that you really love that you had no idea that you'd love. And that's okay. You know, it's okay to change your mind. It's okay to feel strongly about a specialty and then come out doing something completely different. That's okay. That's life.
Oh yeah, that happens a lot in veterinary medicine. That happens, I'd say it's probably more like 85–90% of the time. Like there's very few people coming in, I want to do small animal, that actually go into small animal. It's like, oh, this is fun, I want to do this instead. So yeah, keep your mind open to different specialties.
Yeah.
All right, question number 11. How do you take the next steps after graduation? So this is graduation from college and on to medical or veterinary school. So after you've moved and settled in, the first day of veterinary school, again, you get your student ID, you get your syllabus, definitely start reading and studying as early as possible. If they give you any beforehand information, read it and definitely know your stuff, because those first couple weeks are usually very difficult and it takes a lot of mental energy to transition, especially if you've been at, say, not one of the greatest colleges in the world that you kind of sailed through like I did. So if you have lots of good information, definitely get a handle on that early. As far as graduation after veterinary school, either you're going to be an intern or a resident, and that is pretty much straight laid out. If you are going into general practice and don't have a position yet, now's the time to get out that resume and start mailing yourself off to basically as many practices as you can. Always better to show up in person, preferably bearing cookies, because all veterinary offices love cookies.
Okay, so you've gotten into medical school, you've got your new apartment, you showed up to work. If you applied to medical school with the thought that you wanted to have a lot of fun and not study, it's time to choose a new profession, because agreed, it's a lot of work to learn the entire body of medicine. And people talk about drinking from a fire hose as the metaphor for learning medicine. It's a lot of work, but if you worked hard in college, you're prepared for it. It is very difficult to work part-time or have another job during medical school. It's almost impossible. So I wouldn't plan to have a second job or a second source of income while in medical school, because that can be extremely difficult. Studying in medical school, there's no right way to do it as long as you're doing it. Get in a habit of reading a lot, because that will be the rest of your life, will be self-teaching through reading. So find a textbook that you like and get used to reading in your spare time. Try to stay away from Netflix and Candy Crush and all of the other useless procrastinating time wasters, because you'll find that you'll have less free time during the day You'll have a lot of classes that you need to take and work that you need to do, and you don't have time for Candy Crush. So yeah, you'll learn how to prioritize and make good use of your excess time. If you can get that done early, you'll learn good skills you'll use the rest of your life.
All right, question 12. What would you have changed looking back now?
I have two big things I would change. I think about these a lot. One, I wish I had taken Spanish. Oh, good Lord, I wish I had. I took many years of French, and I got really good at it, and I use zero of that French on a daily basis. I wish I had taken Spanish. It is a bilingual country now, and I really wish that I had enough language skills in order to talk to Spanish-speaking patients, because it's really important. I have enough to say, like, how to introduce myself and say, I can't speak very much Spanish. I need help. I need to get an interpreter. That's number one. I wish I had taken Spanish. And if you're still in the undergraduate or in the college part of your career, I really recommend that you take a class, because you will have patients that speak only Spanish, and you're their doctor and got to communicate. And I really wish that I could communicate better. And then my second is, I wish I had known that there are other medical careers where you could do a very similar job to being a surgeon or being a doctor without having to go to medical school. Being a physician assistant, being a bedside critical care nurse or a flight nurse, being a nurse practitioner. There's just a lot of ways to get to the same endpoint without going to medical school, without being a doctor. Look, had I known about those options, would I have become a physician's assistant and not a doctor? Probably not. I probably would have still gone to medical school, but I had no idea. Physician's assistants scrub in surgeries. They're first assist for a doctor during orthopedic surgeries, and they get to go home at 5 and not have to work weekends and make a whole lot more money than I do. It's an option I never knew. It's 2 years of school. There's a big demand these days. You make 6 figures. It's just a good option, and that I never knew about. So make sure you look into other options if you're thinking about going to medical school. Medical school is a big financial and life commitment, especially if you're interested in having a family or having hobbies or having your late 20s. Yeah, you give a lot of that up to go to medical school, and I educate yourself about alternative options. That being said, if you do have the dedication and the drive and the commitment to be a doctor, there really is no better profession, and all those other careers are close, but they're not the same thing as being a surgeon, being a doctor. So while I wish I had known that there were other options that maybe offered a little bit better lifestyle, I still would have probably become a surgeon, because there is only one way to be a surgeon, and that's to go to medical school and be a surgeon. And it will be a very rewarding career that I'm looking forward to quite a bit, and it has been, and I do enjoy it. Sometimes when I'm up at night or in the middle of the night and I've been up for 16 hours taking care of a sick patient, I think, I wish I'd been a PA. I'd be home by now. But now you know.
Yeah, but you have to be in charge.
Yeah.
As far as changes to my veterinary career, I still would have been a veterinarian. I just wish that I had been more resolute in my desire to be a fish veterinarian from the beginning. At my school, I got a lot of pushback for just saying that I wanted to do something weird. So when I said I wanted to be a fish vet, I had clinicians, faculty laughing at me, like, to my face. And thankfully, I'd found these programs, the Aquavet and Maravet and all these other lecturers, on my own. I kind of just stumbled across them on accident. Nobody had even told me about these programs. So if you're a student, either you're looking to go to veterinary school or you're in veterinary school now and you want to go into something oddball, weird specialty, if it's who you are, screw what everybody else says and just do it, because it's your life. And if you want to be a fish doctor, go be a fish doctor, because I don't think I would have made it very far if I had ended up going into private practice for, say, small or large animal. True, I don't get to cuddle the cute little fluffy kittens or puppies, but I also don't have to deal with their owners. I get to deal with fish owners, and they're a completely different group, and I love what I do. So I wish that, looking back, I just made the decision to be a fish veterinarian earlier and had known about this specialty, that you could do private practice with aquatic medicine. Is it rare? Yes. Is it hard? Oh yeah, it's really, really hard, but It's who I am, and I love doing it, and I wouldn't trade it for anything. All right. So these questions have been added on to our original program. I apologize, some of the text got screwed up. So our question 13, if you're questioning, should you apply and where should you apply? So sorry, that text on the left is wrong. Again, like Bailey said, medical and veterinary school is a very big financial commitment. There's really not a lot of scholarship money available. If you can find some, great, but certainly consider it before you jump into the application process. A lot of people I know are still struggling with their loans, and it may determine what jobs are available to you when you graduate. I mean, certainly if you have to be a doctor or you're just going to die without becoming a veterinarian, certainly you'll make it work somehow. It's a very rewarding career. It is very challenging, but if it's what you're meant to do, you will find a way to do it. Where should you apply? So where you apply is going to depend on, again, what financial availabilities you have. Sometimes you might have to move to a state to get in-state tuition. There's a lot of more public veterinary schools than private ones. And definitely look for programs that say if you want to do a specialty, look at schools that offer that specialty. When I went to Tufts, we didn't even have an exotics veterinarian when we were rotating through. So make sure that you plan accordingly. And if you want to be a fish vet, go to a school that at least has one aquatics person on staff. At least one. One would have been great, but not for me. All right. Next.
Oh, should you apply to medical school? I think if you think that being a doctor would be a good fit for you, if you are hardworking, if you can make that commitment that, you know, a large part of your, 20s and early 30s will be dedicated to learning medicine, yes, absolutely. It's a very rewarding career. It's a great career. It still is, despite all of the, healthcare reform and lawsuits. And that's the minority of what you do. The majority of what you do is very rewarding. So if you're thinking about it, should I apply? Even if you have, think, oh, my grades aren't that good. My grades are mediocre. Yeah, and that certainly plays a role. But if you're thinking about it, yes, there are lots of medical schools. Apply. Where should you apply? You should apply to a geographic location that you're interested in, especially if you have support system, friends and family nearby in the, southwest part of the country. That's where you should apply. If you've always wanted to live in New York City, that's where you should apply. In-state tuition is sometimes nicer than out-of-state tuition, which is sometimes higher. There is a good amount of financial aid available, but at the end of the day, most people need to take out a loan in order to attend medical school, and that's just the way it is. And you'll see the number on the piece of paper and have a small heart attack, and then come up with a payment plan that'll take you the rest of your life. That's the way everyone does it, and so that's nothing abnormal about you or your finances. I think geographic location is the #1 consideration for applying. There is a book, and I wish I had it. It's around here somewhere. It's a book of all of the residency programs. Of all the medical school programs available. It has all the statistics, what their graduates go into, where their graduates go to, how many faculty per student are available, what their years of didactic classes versus years of clinical rotation are. And I found that book very helpful when I was looking at programs, because outside of geographic location, programs are very different, and they have a lot of different strengths and weaknesses. They send either a lot of people into primary care, like family medicine, internal medicine, or they send a lot of people into specialties, like surgery and orthopedics. So knowing those statistics was very important. And then when you've gone to some places, sampled some places, you think, well, where should I end up going to? People talk about the interview that you go on. If you like the people, if you like the hospital, if you feel like you're a fit, that's the right place to go. And that's how I felt with my medical school. I loved it from the first second that I was there. I thought I could be very happy there, and yes, I'd like to go here. And so you choose the medical school based on not only facts, but also, you know, your intuition if you're a good fit.
All right. Question number 14. The question everybody wants to answer is, how do I get into medical or veterinary school? So again, sorry about the text.
We're human too. You have to have good grades, and that's non-negotiable. You can't be a C student and get into medical school. There's just too much demand and not enough, you know, supply. You have to have good grades. You have to test well. There's a mandatory exam called the MCAT that you have to take in order to be an applicant to go to medical school, and you have to do well. You just have to. These days, if you do the science prerequisites, doing other things like being a music major or a humanities major is smiled upon. It means you're diverse and you'll bring a very different ethos to medical school other than the 99 chemistry majors that are also going. So doing other things, other creative things that are not associated with science is not a bad thing. That's seen as a good thing these days. And then while you are in undergrad, your extracurricular activities are also important. People want to see that you use your free time beneficially, that you use it productively, and you're not watching Netflix on Candy Crush. So if you run a volunteer organization, or you work with Habitat for Humanity, or you run a free clinic, or no, you don't have to run it, but like you are productive in your spare time. You can't just eat donuts. If you make the donuts, that's okay too. You know, they want to see that, you have 3 jobs to support your family. That's good too, just that you're productive. Yeah, in your undergraduate time, use it wisely, and schools will reward you. And get used to using your time wisely and not having a lot of free time, because that's your life as a doctor. So if you're sitting there thinking to yourself, well, I like eating donuts and playing on Candy Crush for 6 hours a day, this is not the profession for you.
Nope. Yeah, definitely gonna harp on exactly what Bailey said, is grades matter. It's the easiest way for them to make cuts of the massive pile of applications they have. If you drop below a certain standard, you're gone.
And you may be way more than your grades on paper, but they need a physical number. They need a reason to cut people, and your grades is a physical number on paper, and that's the first thing they'll see. Even if you're a much better person than your grades, it's just not negotiable.
Yeah, it's not going to make a difference however good you turn out on paper, that you're just not going to make the cut, essentially. A lot of those things that they have about veterinary school on the applications, they'll usually put on there what they expect your GPA to be above. So, I mean, you can always call and ask the admissions department, and they'll give you a straight answer. And that way, at least you know where you rank among students. Extracurricular is definitely a big deal. For veterinary medicine, they want to see that you have animal experience. It doesn't matter where it comes from. I did a lot of volunteer work at the local aquarium. I'm sure that made me definitely a more diverse candidate. But I also did work at kennels, animal shelters. I ended up getting my veterinary assistant certificate when I was 16. So they just want to see that you're dedicated to animals, and they don't care where it comes from. You could be a horse competitor. Your family can own a dairy full of cows. I don't know. You can dress cats up in outfits and take fun pictures of them for the internet.
Don't do
your
that.
Cat. But yeah, anything that has to do with animals in any capacity, you need on your application for veterinary school. Yes, you can be a diverse candidate. It can be something abstract like fish or mammals or cats in funny outfits, but
don't do that.
But they want to see that you have veterinary experience. You can be the most diverse candidate, but if you've never done anything with a dog or cat before in your life, they don't want to see that on your application. So make sure that you get some sort of hands-on fluffy animals. Or
similarly for humans, if you show up to a medical school interview having never done anything medical, they'll want to know, well, why do you think you want to do this if you've never had any experience before? And I assume it's the same for veterinary. You show up to a veterinary having never worked with animals, they think, well, how do you know that you want to do this and you won't quit 2 weeks from now because you really like animals? And that being said, having an extracurricular that you're really into and not just show up to a couple of times when you're interviewing at medical or veterinary schools, they'll ask you about it. And if you can speak passionately and coherently about, you know, your efforts in your work and your passion, that's what they want to hear. You know, that's really impressive to be able to talk passionately and deeply about whatever you're into. It's a big benefit. Don't do the cat clothes thing.
Oh, come on, it'll be fun. All right, and our last question on this add-on session is, how do you become successful in this career path? So again, I apologize for the text on the left. Basically, the way to be successful in...
Attention to detail. No.
If she was here, I'd punch her. But definitely, you need a good work ethic. You need to work hard, and you're going to have to sacrifice a good part of your normal life for your career. It's just what you're going to have to do. Unfortunately, you are going to lose time with your family and your friends. I have no idea how my classmates went through this program with children. Because, I mean, I have 3 cats, and I barely see them.
It is possible, though.
It is possible. But again, the people who are closest to you, they need to understand that your job is your life for who knows how long. So for Dale, it's what, 8-9 years? For me, it's 4. But then I decided to open my own private practice, which, again, taking on a new veterinary career in addition to a business is a lot of work. And for the first couple of years, I couldn't sleep through the night because things just kept coming up in my head. I slept with a notebook under my pillow for 2 years. I'd actually be scrolling things in the middle of the night. So, I mean, I love what I do. I love my job. I love my practice. Thankfully, I have a very, very understanding family who obviously are going through it again with the next daughter. So I think at this point, they've just kind of gotten used to it. That we're both very driven by our careers, but we're both very satisfied with where we are right now.
Yeah. Yeah, so what was the question? How are you successful?
Yes. How do you become successful in this career path?
Yes. Work hard. That's number 1. You will be as successful as you want to be. You will be successful if you want to be. If you work hard and put your back into it, you will be successful. 100%. Take your time. It's a long journey. And that annoying thing that people say about life is about the journey. It's exactly true, okay? You will be in medical school, in residency for a while, and it's not a race to the finish line. Enjoy it. Enjoy your experiences. Enjoy your friends. Enjoy the journey. That's how I hate myself saying that. My spleen just the ball. Say that, but take your time. It's a very long journey. And then I'll echo a little bit of what Jessie said. If you don't let other people discourage you, and you will get a lot of that. You'll get a lot of people, you know, say, well, why don't you have a job by now? You know, why don't you do something else? You know, you're never around anymore. Don't let people discourage you from doing what you want to do. It's really easy to comment on lifestyle these days. It's a lot easy for people to say you're doing the wrong thing, but you're doing the right thing. You're working hard, you're making a difference. And as long as you're doing what you want to do, don't let anyone else discourage you, because it is the right thing to do. That's how you'll be successful. Work hard, read a lot, don't listen to other people.
There you go. So additional questions. With this redo, I think we only have one attendee, and he's related to us. So if you have any questions, we're going to ask that you go ahead and send them to my email address. My website is there with more background information on me. Bailey does not have a website. If you want, you can go Google her through the UNC Chapel Hill. She has a lovely picture, and that's it. So thank you very much for sitting through and attending. If you have any questions whatsoever, I know this is kind of a daunting task, especially if you're just coming at it. But yeah, any closing remarks?
To answer our one attendee's question, you should fill your bathtub with water today, and butterscotch pudding cups keep the longest during a hurricane.
I told them to ration those already. All right. Well, thank you very much for attending.
90% of the pudding cups are gone.